So very warm greetings to all our viewers. Today we have with us Varun Garg, Senior Vice President and Industry Head at Polestar Solutions. So hi Varun, thank you for joining.
Hi, Devadatta. Hi, good morning. Thanks for having me here. Very excited to talk about this session today.
So Varun, how's the weather in United States and how's Charlotte treating you?
Well, today I'm not in Charlotte. I'm in Dallas today. It's a nice, pleasant day. It should be raining in a couple of minutes. The weather in the ranges of 69, so I think it's a good day to start this session.
So Varun, I request you, and it would be great for all our viewers if you tell us a bit more about you and your role and your experience at Polestar Solutions.
Well, I'm now in Polestar for almost a decade. So I've started my journey with Polestar when Polestar was just formed. In Polestar, I've taken up multiple roles, right from sales manager to be the analytics head and now industry head. Currently, in my role, I take care of multiple industries, out of which senior housing is the most predominant one that is close to me and where my most focus is. And in this domain or in this industry, we have served multiple, you can say, customers who are basically ranging from operators as well as REITs. So we have got a good coverage of, you can say, our customers in US as well as UK market, and this way we are planning to expand our, you can say, services to multiple more operators in the same market, as well as expand our, you can say, footprints in in the Asia Pacific market as well.
Great to have that, Varun. So to set today's context for our audience, could you comment on the size of the senior housing industry globally and how much is the projected growth in this sector?
Sure. So senior housing industry is actually a growing sector worldwide, and this is because the aging due to the aging population continues to increase in many countries. The global senior housing market size is valued at somewhere about $90 billion in 2020, and it is expected to grow at a CAGR of 5.5% from 21 to 28 roughly. Now, there are multiple attributes to this growth factors increasing. This is because of increasing of number of elderly people, rising healthcare costs, and growing preferences of senior housing communities among the elderly population. Now, in terms, if I have to give you a rough regional breakdown, North America is currently the largest market for senior housing, followed by Europe and Asia Pacific. However, the Asia Pacific market is expected to experience the highest growth rate for the forecast period due to the rapidly aging population and increasing disposable income. Now, it's worth noting that COVID-19 pandemic has a significant impact on senior housing industry, with the occupancy rates declining in many countries due to health concerns and restrictions on the visitations. However, as the pandemic has subsided now, the global population continues to age. Industry is actually expected to rebound and continue to its growth trajectory.
So, Varun, you have been associated with this industry for a long time, and recently you also published a blog on personalized home care and how it's becoming an affordable alternative to our traditional senior living homes. So, what's your take on which direction is this industry heading?
Uh, well, there was a lot of reasons why I've written this post because yes, it's true. Personalized home care has become an increasingly popular and affordable alternative to senior living homes, right? As many senior prefers to age in the comfort of their homes while receiving necessary care and assistance. This trend is actually expected to continue in the coming years as the aging population continues to grow and demand for in-home care increases. Look, obviously, that given an option to like take health, you can say take medication at the comfort of your home, or versus you have to go and visit somewhere else, you would also choose home, right? And that's how exactly it is happening here also. One of the main advantages of personalized home care is that it offers seniors more autonomy and independence, right? As they can remain in their own homes and maintain their routines and lifestyle. Additionally, personalized home care can be more cost effective than traditional senior living homes, right? Which can be quite expensive. I do see that there are some challenges that are associated with the growth of this home care industry. And one of the prominent challenges ensuring that seniors receives adequate and consistent care from qualified caregivers, as there is currently a quite a shortage of trained professionals in many regions. Traditionally, there may be concerns about safety and security of seniors who lives alone and receives in-home care. So it is important to address these challenges, which will require collaboration between policymakers, industry stakeholders, and technology providers to ensure that these personalized home care services are, or say, remain accessible, affordable, and high quality for seniors who need them.
Right. So, like from your response, I gathered that a lot of data must be getting generated about residents, and similarly, handling a workforce to provide them with proper care is a very important aspect. So, how does data management and workforce planning impact the overall quality of care in the senior housing industry?
Well, this industry sees a lot of data, and when you see a lot of data, the first thing is that you collect the data, right? By collecting, organizing, and analyzing residents' data, senior housing providers can gain insights into the unique needs and preferences of their residents, which in turn will help them deliver personalized care and services. Now let's take an example for this. Say by analyzing residents' medical conditions, medical or medication schedules, different care plans that they are enrolled in, providers can actually identify potential health risks and take steps to prevent them. Similarly, by tracking residents' activity levels and social interactions, right, providers can identify opportunities to increase engagements and prevent feeling of loneliness and isolations that leads to actually personal home care. Effective data management can also enable senior housing providers to track and monitor residents over, you can say, outcomes over time, which can help them make data-driven decisions and to how to improve and their care services. This can actually lead to better health outcomes, higher level of, you can say, resident satisfactions, and a more. Now, if you see this industry is all about there are the two bodies, right? One is the caregivers and second is the caretakers. Now, in terms when we talk about senior housing care, you can say operators, they rely on caregivers, which are in-house, you can say workforce, as well as they also augment the workforce, or you can say extend the services to the you can say third-party agencies many a time, right? And for that, they have got separate budgets and everything. Now it becomes very much important that they manage their workforce efficiently, because without that, it could be that they are having an X budget and they are overshooting the budget by outsourcing multiple things. You can say because of the wrong workforce planning strategies, their overall budget gets exhausted very soon, right? So workforce planning can actually help them to address some of the challenges associated with the growth of personalized home care industry, such as caregivers burnout, turnover, everything. Now, by understanding the needs and preferences of caregivers, providers can actually develop more effective retention strategies and ensure that their workforce is equipped with tools and resources they need to provide high quality care. Let's take an example for this also. Real time data can be used to monitor caregivers' availability and response time. This will actually ensure that the patients receive timely and consistent care. It can also help or be used to identify areas where additional training and support may be needed to improve the quality of the care provided, so that there is a happy resident, there is a efficient working model, and there is a efficient, you can say, workforce that is, or adequate number of workforce available all the time to serve the residents in the best possible manner.
Right. So, Varun, you have since you have been associated with the industry from very close quarters now, and you must have also interacted with various stakeholders like senior housing operators during your time. So, firstly, what according to you are some of the common challenges associated with managing data in senior housing? And secondly, what do you think is the way forward to address these challenges?
Oh, there are. There are many challenges when it comes to data management in this industry. And that's the reason why there are many projects that are currently going on at different operators only and only around data. Now, as we have talked about already, that this industry sees a lot of data and data coming from variety of the source systems, right? But if I talk about challenges, the foremost and the biggest challenges about this particular data management is data accuracy and completeness itself. Now, let's talk about let's talk about a case wherein how when I cite data completeness or accuracy as a challenge, how exactly it is happening. Let's say as an operator, I have got my all my sophisticated, you can say, systems to that I'm going to use for my daily operations, right from sales, CRM to billings, financials, everything. Okay. Let's take an example of CRM, and that's the most common problem, in not just in this industry, but in a variety of the industries. As a director of sales, right? I have got a CRM in place where I do my entire lead tracking. Now, the lead could have been generated by any means. It could be an inbound call, it could be a walk-in, it could be a agency-driven, or you can say lead, it could be a marketing-driven lead. The moment a lead comes in, there are variety of, you can say, CRM stages that needs to be, you can say, run through before you say that okay, that it's a converted close one or close loss. That means it's a move in or it's actually lost in the funnel. Now, as a CRM guy or as a sales guy, it is actually my responsibility to, whenever I get a lead, I move the stages right at the time when the movement is happening, because that will actually ensure first the completeness and readiness in terms of when if I have to say that okay, how many people I'm planning to move or are looking, you can say, positive in my funnel that are going to move in next 2 weeks, 3 weeks, 4 weeks of time, I can actually rely on that data. And secondly, when we have these, you can say, data filled or you can say properly maintained, we can take database decisions basis this particular data, because the thing is, if I can see the movement stages in my CRM, I can as an operations director, I can take a call whether I have got the proper vacancy in the clusters of the community where the stages are moving, so that I can ensure that if a resident is coming in, say for assisted living or independent living, I do have my proper, you can say, rooms available. It could, if the resident is coming for a private room, I have to ensure my private room is available. Now, for this, I have a dependency that my CRM guys are actually doing filling the data completely and accurately. If my CRM guy is actually going and filling like the stage in one day for all the movements, right? And I immediately ask that, okay, now I've got to move in, give me a room. Obviously, that is going to be a problem for my facility manager. So
Exactly.
data completeness or incomplete or inaccurate data can actually lead to flawed analysis and decision making, which is important to generate reliable insights. Now, one is data completeness and accuracy. The second is about integration of, you can say, different systems that we have here. Now, as I've talked about, there are many, you can say, systems that are being developed, or you can say are there in offer that operators use for their daily operations, right? From CRMs of the world to ERPs, billing system, time clocking system. Let's take a few names. Let's take a, let me talk about one of my operator, right? And I cannot take the name, but the thing is, we were dealing with this operator when they used to have share price, their CRM tool. They have got ERD as their ERP tool. They have got point click care as billings. They have got Chronos as time clocking. All of the beautiful tools, all available in their start to, you can say, fulfill or you can say run their business. And if we see this entire technology stack in isolation, these are like I'll say these tools actually fulfill the entire purpose that they need to run their business, right? However, if all of this was available, then what was the challenge? The challenge was that these tools were not talking to each other. So the thing is, if suppose I've got a lead in my CRM that has got converted into a move-in, I have to go and create a move-in manually in my ERP system, in my billing system. Now, due to which what happens, if suppose say I get a bit late in creating this particular move-in, my facility manager may have to do the process in either in rush, or it could be a case that if it is a immediate move-in, right? My my resident is standing on the gate and I don't have an entry, right? Similarly, if I talk about report, you can say analytics perspective, CRM analytics in isolation is getting fulfilled by the either the OEM itself or the tool that we have applied on top of, you can say Sherpa, for example. However, as the CXOs, as my sales directors, you can say sales, as my sales strategy officer, as my data office, chief data officer, right? If I have to see the entire flow in as one go, and if I want to see that, okay, tell me how many movements, what different stages of my funnel, how many movements, what kind of, you can say, revenue projections I see. I've done a campaign, you can say 2 months or 1 month back about that should convert into more leads, right? What is my campaign effectiveness? How much lead conversion ratio I have? Whether my billings are actually tying with my financials that I'm billing, right? Whether my time clocking for my internal and external, you can say, resources that I use are actually under the kind of budget that I've kept for my hours in terms of utilization for my resources. All these informations make sense when when they are seeing in correlations, right? If I start seeing that, okay, how many number of hours I had, you can say, provisioned for my third party vendors, and I don't get to see that, okay, what is the actual time in the real time. Vis-a-vis, if I talk about that, okay, I in a particular cluster of my property, I have got 10 independent living room available in a private sort of suite, right? However, for the same cluster or the property, my entire CRM funnel is sitting in assisted living, right? It makes no sense, right? So the thing is,
Right.
all these visibility and interconnectivity between the multiple products actually gives you better view of your operations, and it will give you better decision making, like it gives you the tools to do better decision making so that you can run your process end to end efficiently. So to summarize that, I think using multiple data sources, integrating these different data sources can be challenging, but doing so is actually necessary to gain a comprehensive view of your residents' health and well-being and run effectively your operations. Now, just think of the scenario, like what we have just talked about. So many systems, so much of data. All data is coming in. And when you are not clustering, or you can say putting the right chunks of the data where it should sit and start the data to talk to each other, it is becoming actually, it, uh, it is actually given you can say, rise to the problem of data overload.
Right.
Operators have to now, you can say, use data management tools and technologies that allows them to analyze and interpret this data efficiently. Otherwise, we are actually getting into a data swarm sort of situation, and it happens. Now, the last but not the least, the most important part is you got all the tools, you got all the integrations built and everything, but you should also train your, you can say, staff to start using these tools efficiently and to their capacity, because like staff may not have the necessary skills or knowledge to manage these tools and the data effectively. Operators actually should invest in staff trainings and development to ensure they can use data management tools and technologies to their full potential. Now, to address all these challenges, senior housing operators can actually implement best practices such as data protection policies, you can say staff training programs. They can also invest in data management technologies that can help them integrate multiple data sources, manage data overload, improve data accuracy and completeness. Additionally, like providers can always work with external partners such as data analytics firms to gain additional expertise and insights into managing and leveraging their data.
That was like very elaborately explained, Varun. Like, if I'm a senior housing owner or operator, those were some amazing insights into the challenges that we are facing. So, Varun, since Polestar is into leveraging data to find actionable insights, could you shed some light on how data analytics can be used to identify various trends and patterns to help our healthcare care providers improve their care and services?
Sure. So data analytics, like I've said, we have done it for multiple operators in different markets. Currently, data analytics can be used to identify trends, patterns in residents' data that can actually help senior housing providers improve their care plans, their services in multiple ways. Now, let's take some examples here again. Okay. Let's first start from the resident side and then we'll come to the operator because ultimately there is a gain for both.
Right.
Uh, when we start using data analytics, right, to find patterns coming from the data, we can actually identify the health risks that could be associated with a resident. Now, for example, if several residents experience a sudden increase in their blood pressure or glucose level, right, this could actually indicate a larger health issue that needs to be addressed. And if you have got a tool or a dashboard that can actually alert you this immediately, right, you can take a call right away before some tragedy happens, right?
Right.
Similarly, you can have these tools and technologies actually gives you the way to see into the financials, or you can say the kind of plans that you have given at different acuity level to your residents. So that, say for example, if I talk about a KPI around improving your care plans, we can talk about a particular medication is, say for example, when it is given to a particular a resident or a group of residents is not actually producing that kind of results which are desired, right? So providers can actually adjust their care plan according to the needs. And so for that, this sort of dashboard actually can give you that view into it. Now, this industry sees like this industry sees a lot of, you can say, challenges when it comes to residents in terms of loneliness and the feeling of, you can say, isolation. Like, if we talk about how these residents are getting, you can say, engaged in their properties, that is actually a very important KPI for any operator. Reason being, the more your resident is engaged socially in the premises that they are actually living in, the chances that the length of their stay is going to increase, right? So this can actually help them to take steps to identify trends and patterns that may indicate the feeling of loneliness, isolation, and enhance their social engagement to prevent these negative feelings that may rise in the mind of the resident. Last but not the least, again, from operators' perspective, it is all about improving their operational efficiency, right? So by
Right.
analyzing data on staff performance, turnovers, and you can say other operational metrics, there are many, right? Providers can actually identify areas for improvement and make data-driven decisions to increase their efficiency.
So the thanks for like listing out those use cases of data analytics here. And now we come to the talk of the town, and we even we cannot escape it. So there's been a lot of chatter about the capabilities of ChatGPT in various industries. So do you think we can leverage its AI to a very beneficial effect in the senior housing industry?
Oh, AI, I'll not say AI is new to this industry. AI is always there. There are many examples that I can cite for the use cases of AI. But ChatGPT is definitely new, and it's not new only for this industry, but for many industries there, right? I feel this is something that is still a piece of, you can say, discussion. But the thing is, that's my personal belief that there are several ways in which ChatGPTs or the AI capabilities of ChatGPT can be applied in this industry to improve the experience of seniors and caregivers. ChatGPT can be trained to understand natural language. That's its forte. And basis that it can actually respond to questions and requests from seniors, such as like help them schedule their appointments, reminders for medication and stuff. This can help seniors feel more independent and in control of their lives, and by this in turn reduces the workload on the caregivers. Now, ChatGPT can also be used to analyze data from wearable devices and other sensors that are applied. You can say that are installed by caregivers in the facility, right? This will actually help to identify patterns or anomalies that may indicate a health issue. Now, this can help caregivers detect potential problems earlier and take actions to address them. ChatGPT can also be used to provide emotional support to seniors, and this may be subjective, but this I feel is going to be the most important element of ChatGPT in this industry because here the seniors who may be experiencing loneliness or depression sort of feeling, right, by engaging in a conversation with seniors, ChatGPT can help to alleviate feelings of isolation and provide companionship. And I feel this is going to be the most important and successful use case of ChatGPT gonna be in this industry.
So a very related question to my previous one. How does AI compare to there are smart devices in the markets, right? So how does AI compare to them? The smart devices like monitors and sensors that we are seeing in various wearables and other medical equipment.
As I said, AI is not a new word to this industry, right? There are many implementations of, you can say, AI based projects in this and smart devices based project in this industry. Now, let's when you're talking about specifically around monitors and sensors, let's talk about it. Now, AI and smart devices such as monitors, sensors, in wearables and other equipments are not mutually, you can say, exclusive, but can be complementary to each other. Okay. Both AI and smart devices have their unique capabilities and, you can say, strengths that can be leveraged to provide more comprehensive and accurate insights and recommendations. Smart devices such as wearables can monitor and collect data such as heart rate, blood pressure, sleep patterns, right? This data can then be analyzed by algorithms to identify patterns or anomalies that may indicate a health issue. Now, for example, let's take an example for this. If a wearable device detects an irregular, you can say, heartbeat, an AI algorithm can analyze the data and alert the wearer or the caregiver if a medical attention is needed. Now, this is one of the use cases, but this is very important because the thing is, in order to serve our residents better, right, or the best, we need to ensure that any such anomaly should be alerted and we take a proactive action before some tragedy happens. So I think this AI has already contributed big time to this industry, and there are many more, you can say, use cases that can actually be enhanced or used to actually provide enhance the services that we are giving to the caregiver. You can say care seniors in this industry.
Thanks, Varun. I personally am looking forward to see how AI goes into this industry to help the residents further in their caregiving. So, and it brings us to the next part of our chat. Actually, it's my favorite, which is the rapid fire section. So, Varun, we need some quick, snappy answers from your side. You ready?
Sure. Yeah.
Yeah. So, senior housing in institutions or home care, which is your bet for the future?
I'll always bid for institutions for long run.
Right. So, according to you, what are the three essential categories of data collection that senior housing operators should definitely focus on?
Well, other than the operations data that any which way is capturing, it is important to capture health, social, and behavioral data.
And how would these three categories of data will be helpful?
Oh, well, when you you can say collate all this data, right? It will actually eventually reduces the workload of the caregivers.
So, again, according to you, what is the biggest difference that data management will bring to improve the overall senior housing experience?
If everything is taken care of, we can give a amazing personalized care experience to our seniors.
So, since a lot of data is being captured by all systems in the industry, so what do you think are the three challenges of data management in senior housing?
Um, we have talked about multiple at the start, but if I have to
Right.
like and say give you a concise three challenges, I'll talk about privacy, security, and ethics for data management.
So thank you. That brings us to the end of the session. And Varun, I again thank you for joining us today, sharing your valuable insights and inputs. And we look forward to more such engaging sessions and conversations. And the senior housing and care industry is one very interesting domain. And I cannot see how it affects the hospitality and services industries both in the future.
Thank you, Devalita, for having me here. It was amazing talking to you. Yes, have a good day.
Thank you, Varun.